Let's now tell you about the heart-wrenching, man-made tragedy that unfolded in Pakistan. At least 14 newborn babies lost their lives in a devastating fire. This was at a hospital in Islamabad. Just for context here, the Pakistan Institute of Medical Sciences is the biggest state-run hospital in Pakistan's capital. The hospital, in fact, recently made news after authorities took the jailed former Prime Minister Imran Khan to that very hospital for a medical checkup last week. The fire broke out on the third floor of the Mother and Child Health Ward at this premier public hospital. Investigators have said the fire was started by a faulty air conditioning unit, which exploded inside the nursery where newborn infants under intensive care were sleeping. The incident is among the deadliest hospital fires in recent years in the country. A country where government healthcare is subsidized, but facilities are under-resourced and overburdened, to say the least. In fact, watchdogs have frequently criticized state-run facilities as mismanaged. Some 19 people, including 7 children, were rescued. Witnesses described chaotic, harrowing scenes, including intense smoke, broken glass, a slow response from emergency services, and guards reportedly preventing them from leaving the building. Imagine that. Eyewitnesses, in fact, recounted the horror as coffins were being carried out into ambulances at the hospital mortuary.
At around 5:45 or 6 in the morning, we heard about 10 to 15 very loud explosions. We were sleeping outside in the hospital's porch. At first, I thought perhaps they were firing a ceremonial salute for Rabi al-Awwal, because they sometimes fire cannon salutes, so I assumed that was what the sound was. About 10 minutes later, my brother-in-law went upstairs and called us from there, saying that the ward upstairs was on fire. We immediately ran upstairs. We didn't even have shoes on. When we reached upstairs, we couldn't get as far as the ward because it was completely filled with smoke. We couldn't see anything ahead, and it was becoming difficult to breathe.
Authorities insist there was no delay in help arriving for the terrified parents and infants inside. But parents who lost their days-old babies in the fire have a different story to tell. They allege their desperate cries for help took several hours to arrive.
What did they go to get downstairs, leaving the children alone? The door of NICU was locked. I do not believe this. Give me my child back.
This is tragic, heart-wrenching, absolutely disturbing. In fact, the Prime Minister has now ordered a probe and said that those responsible should be identified and the strictest possible action should be taken. He has sacked the Health Secretary, the country's top civil servant for the department. An initial probe by the fire department found that fire and life safety arrangements were inadequate, compromised, and were not as per the standard requirements. The probe found that emergency exits and access routes were locked from outside. Security staff created hindrances to the initial response of the fire crew personnel. Inadequate crowd management was also observed at the incident site. In fact, the UN Children's Agency, UNICEF, said it was deeply saddened by the deaths and called for an urgent review and strengthening of fire prevention and safety standards across health facilities. Now, fires in large buildings are also frequent in Pakistan, by the way, often due to poor safety laws and building codes, as well as lax enforcement. In January itself, more than 65 people were killed in a shopping center fire in the port city of Karachi. At least 11 people were killed in another shopping mall fire. This was in Karachi in 2023. In 2012, at least 250 laborers lost their lives at a garment factory in Karachi.